In May 2008, Dr. George "Doc" López, CEO and founder of ICU Medical, was given the diagnosis that he had Parkinson's disease. As a board-certified internist, he more than anyone knew that his prognosis was grim. He looked at the word incurable in his neurologist's letter, and it read like a death sentence. Doc became determined to devote whatever time he had left to work towards a treatment for Parkinson's. Even if it was too late to find a cure for himself, he would push the science as far down the road as he could, and in doing so, bring hope to the millions of patients suffering from the disease worldwide.
I'm not going to let that disease win. The way it wins is it takes everything away from you, and you freeze up and get locked in your body. What could be worse than that? I'm doing the way I live my life, is to do it while I can. And sometimes Parkinson's wins, and sometimes I win.
Dr. Kwon-Soo Kim from McLean Hospital at Harvard Medical School was closing in on a treatment for Parkinson's disease using induced pluripotent stem cells. By taking a biopsy of a patient's own skin cells and treating those cells, Dr. Kim's lab was able to reprogram those cells to produce dopamine. However, by the middle of 2013, Kwon-Soo's pursuit of a treatment for Parkinson's using iPSC therapy had stalled. Without a major influx of funding, Kwon-Soo knew that he would not be able to move his research forward. On June 15, 2013, he gave a speech at the Boston Convention Center. Later that same week, he was faced with the unpleasant task of preparing pink slips for several of the staff members at his Harvard lab. Unknown to Kwon-Soo, there was someone in the audience that evening who not only shared his vision, but was willing and able to fund it.
When I met Doc, he mentioned very clearly that I hope I can be benefited by your research, but if that is not the case, at least I hope that other human beings can benefit from your research. And I really admired his philanthropic spirit.
Doc and Kwon-Soo put together a team comprising some of the best minds in the country.
So we worked day and night, literally, and we were very happy to make progress faster than we thought.
In 2017, after almost a decade of laboratory research and years of painstaking regulatory work, the FDA approved a 2,500-page protocol for a procedure to treat a single Parkinson's patient with the implantation of dopaminergic cells into the brain. Doc didn't hesitate to volunteer. By early 2017, he was suffering from the advanced stages of Parkinson's disease. He was experiencing significant side effects and reduced benefits from the L-DOPA medications, and his quality of life had diminished to the point that he knew instinctively that he didn't have long to live. Doc was evaluated by independent neurologists and found to be a suitable candidate for the single-patient trial. Doc went into surgery fully aware that there was no guarantee of any lasting direct benefit, but that the knowledge gained from carrying out the procedure would benefit others. He was perhaps the most informed patient his neurosurgeon had ever met.
Doc told me, use myself, use my body to test whether your science and your research can make a difference in Parkinson's disease. He is the real hero.
The first Parkinson's disease patient, which is me, has been safely and successfully treated by his own cells. I'm improving every day, every week, every month.
Keep going, Doc.
2 years after the procedure, even though Doc's condition has improved measurably, a word of caution. Doc's accomplishment is not a cure for Parkinson's. It's a successful treatment that has been effective for one person. This is just the beginning of a complex path that will take years to explore. Many more people need to be treated successfully in order for this procedure to become a viable therapy. Doc's great legacy is that by offering himself as patient one, millions of Parkinson's sufferers now have some hope that at last, we may have finally started down the path to a cure.